Hello, I'm Dr Ian Strawford. I'm a cosmetic doctor and I'm the medical director of the Skin Excellence Clinics. I wanted to talk to you today about the consultation that you have when you come to Skin Excellence Clinics. This is the introductory consultation, which is either myself or one of my doctors that are going to be doing that consultation with you. And I want to talk about the importance we place on that consultation and why it's so important for you when you come. So let's talk through the process. So you made a contact, you may have done some research yourself and come with a specific idea of a treatment that you may think you'd like to have or may need, or you may have looked at our website and been completely confused about the treatments that we have to offer. And so again, the consultation is a way of getting to the bottom of that. We'll send you out a questionnaire, which is a simple questionnaire to fill in before the consultation, which is really regarding your past medical history, your concerns, conditions, whether you've had any previous treatments, etc. Just so we've got that background information when you come, which we find very helpful. When you attend the clinic, we will be using photography to make assessments. We're going to talk specifically about the skin and of the face and neck. We'll be using 3D photography and other photography to get the background, and we will work with you using that photography to look at what your concerns and conditions are. We'll explore that, and I like to view patients holistically. So there's more going on than what we see on the surface, and so it's really important to discover any health issues you might have or other things that might be affecting the aging process, so to speak. So we can look at the importance of those alongside any treatment that you might have. Now, at Skin Excellence Clinics, we have a huge variety of treatments, some more invasive than others, some very natural and regenerative. We have pretty much everything covered for you. So it's actually looking at what's important to you and me helping you, showing you what is happening, educating you about, for you, what's been happening with the aging process and how that is particularly affecting you. Because although there are similarities with all of us and how we age, there are differences, and some may be being affected by other things more than others. So we need to look at that specifically. And then we'll look at the treatments that potentially can help you, the pros and cons, the effectiveness, the side effects, the complications, the risks, etc. So we'll go through all of those with you. So at the end of that consultation, hopefully we'll have what we call a patient treatment plan. So we'll have options. Now, it may be that those options may not all be possible straight away, but there's a future plan for you that we can review and we can revise, but we're looking at that plan of how we can holistically help you. And we'll come away from that, and we'd like you to then not necessarily have treatment on the day, and we prefer it that you go away and you reflect on what we've talked about. And it may raise more questions, and we're very happy to answer those questions down the line. But most of our patients really value this process, and I think that's what makes us different from a lot of clinics. It's not about bums on seats and getting as many treatments done as possible. We like you to be really informed about what you're doing, why you're doing it, and how it's going to work and affect you. And we're always going to be there if things don't go to plan or if we need to change course. We're always there to review and revise. So that I'd just like to say that is why we put a lot of importance on that consultation. We give you that time for that, and we get a lot of positive feedback from our patients that actually that's the one thing they've found very valuable and helps them, gives them the confidence, because I know many people come really anxious about the treatment. And many patients come, perhaps they've done their research and they've seen something advertised on the internet or social media and they think that's the treatment for me. But actually when we get down to it, it may not be the treatment for them for lots of reasons. So my job and our job is to try and guide you through this sort of what seems like a complex area and make sure what you have is safe, effective and appropriate for you. It's personalised care. That's what we're about.